If you are a smoker, you need to watch this video. If you've been smoking for a while, you might wonder if quitting's even worth it. Maybe the cravings and nicotine withdrawal just turn you off to the whole idea. You wonder, the damage is done, so does it really make a difference? Absolutely. Your body has an amazing ability to heal itself, and it happens quicker than you think. Less than half an hour after you put out that last cigarette. And keep in mind, you're more likely to succeed if you have a plan to handle those cravings, especially in the first few weeks. In a moment, I will explain the effects of quitting smoking in days, months, and years. 20 minutes, decrease in blood pressure. Your blood pressure rises within minutes of your first drag on a cigarette and hit of nicotine. It drops back down to normal levels within 20 minutes after smoking. Drop in heart rate. Smoking just one cigarette a day has been shown to raise your heart rate, making your ticker work harder to get its job done. Why is this important? A higher heart rate is considered a strong predictor of death from cardiovascular causes. Temperature increases in hands and feet. Smoking causes your blood vessels to narrow, which can constrict blood flow to your extremities. Those blood vessels start to open back up quickly once you put out your cigarette. 8 hours. By the end of a workday, you have half the amount of nicotine and carbon monoxide in your blood. Why does that matter? Carbon monoxide is a chemical in cigarettes, and it crowds out oxygen in your blood. That causes problems from your muscles to your brain because they don't get the oxygen they need. But as the chemicals levels drop, your oxygen gets back to normal. On the flip side, it's likely you already feel some early cravings and doubts. That's normal, but they usually last just 5 to 10 minutes. To get you through, try to find ways to distract yourself until the feeling passes. You could try making a craving playlist, chewing gum, or sipping water. 12 hours. When you smoke, you have 3 to 15 times more of this toxic chemical in your blood than someone who doesn't smoke. At higher levels, you might have a headache, faster pulse, dizziness, or nausea. That level drops to normal less than a day after you quit. That makes room for more oxygen in your red blood cells that you need for your heart, brain, and other organs. 24 hours. Smoking is the top cause of heart attacks. Your risk goes down after just 1 day without cigarettes and continues to drop after that. If you've already had a heart attack and cut out cigarettes, you cut your chance of having another one in half. 48 hours. With 2 days down, treat yourself to something tasty. By this point, your senses of taste and smell get sharper as your nerve endings start to heal. Your body's also busy with a lot of cleanup. Your lungs kick out mucus and other gunk left from cigarettes, and you don't have any more nicotine in your body. This is also about the time when the toughest withdrawal symptoms show up. You might feel anxious, dizzy, hungry, or tired. You might get headaches or feel bored or depressed. It's normal, but it also makes it a lot harder to keep from lighting up. Stick to your plan. Go to a movie or a store where you can't smoke. Lean on your support network, whether it's friends or family who are rooting for you, an app, or a free call with a quitting hotline, like the National Cancer Institute's Quit Line. If you have asthma, your symptoms may get worse around this time. That can be confusing, but it's part of the process and won't last much longer. You'll likely see improvement by day 3. You can talk to your doctor about how to keep your symptoms in check. 72 hours. Bronchial tubes. Cigarette smoke inflames these pathways through which air moves in and out of your lungs. That can make it harder to breathe. But it starts to get much better just 72 hours after you quit as the tubes start to relax. You might notice a boost in energy, too. 2 weeks after quitting. After withdrawal symptoms peak, they start to decrease, impacting you less over time. Though you may still feel restless or jumpy for a couple of weeks, in addition to sometimes feeling grouchy, irritable, or having trouble sleeping. It's important to recognize that cigarette cravings can still persist during the first 2 weeks of quitting as you work to adjust to your new life without smoking. 3 months after quitting. By the end of week 6, nicotine withdrawal symptoms, including anger, anxiety, depression, difficulty concentrating, insomnia, and restlessness, will have largely disappeared. At the 3-month mark, your body's circulation has improved, making it possible to tolerate physical activity better, and lung function continues to see improvements as well. Some people with COPD nearly double one measure of lung function called forced expiratory volume in 1 second, FEV1, by week 6. While these improvements may not be as dramatic moving forward, they tend to continue gradually in people with mild to moderate COPD and remain relatively stable for people with severe COPD. 9 months after quitting. Many ex-smokers feel a sudden letdown once they get beyond the 3-month mark. Physical improvements taper off while cigarette cravings may persist, albeit at a lesser rate. This doesn't mean that your health isn't continuing to improve. In fact, the tiny, finger-like projections in your respiratory tract, called cilia, will have regrown during the first 6 to 9 months, making it easier to clear debris and mucus from your lungs. While this may actually cause increased cowing after quitting smoking, it is a sign that your lungs are getting stronger and trying to heal themselves. As a result, you should start feeling more energized and be able to perform daily activities with less shortness of breath and fatigue. 1 year after quitting. By the end of year 1, your risk of heart attack and stroke drops by about half, and people with COPD may continue to see some improvements to their lung function. The improvements you see with COPD can depend on the severity of your condition. Those with mild to moderate COPD may see more positive changes, while people with severe COPD could experience a leveling off of their earlier gains, or even a slight reversal. If this happens, it doesn't mean that you're going backward, but rather that you need ongoing COPD treatment to further slow the progression of the disease. Beyond 1 year of smoking cessation, the health benefits of smoking cessation appear to continue over time. After 5 to 10 years, your stroke risk is reduced, and your chance of developing certain cancers is halved. After 10 years, your risk of lung cancer is about half of a current smoker's. After 15 years, your chance of developing coronary heart disease is similar to a non-smoker's. Your long-term health outlook depends on a variety of factors, like your overall health, how long you've smoked, what age you quit, and your other health-related behaviors. Quitting at a younger age can further reduce your risk of developing health issues. Your lungs after smoking. You can't necessarily undo the structural damage that smoking causes to your lungs. That said, the cilia in the lungs start to return to normal function between 1 and 12 months of quitting smoking, with continued lung improvements occurring over time. The length of time it takes the lungs to heal as much as they can depends on how long you smoked, how old you were when you quit, other medical conditions you may have, and other lifestyle factors. For people with COPD, there are additional lung-based benefits associated with quitting smoking. For instance, many find that they have less frequent exacerbations or acute breathing difficulty attacks after they no longer smoke. Can you clean your lungs after you quit smoking? While there is no product or quick fix that will clean or detox your lungs after smoking, quitting can still improve your overall lung health. Your lungs are self-cleaning and will begin to heal themselves after you stop smoking, though the extent to which they heal depends on your overall health, how long you've smoked, and your existing lung damage. If you're concerned about your lungs, there are steps you can take to protect them. These include quitting smoking. Cessation is the best way to avoid lung damage associated with smoking. Getting enough exercise. Exercise helps strengthen your lungs and heart, allowing your body to move oxygen around more efficiently. Avoiding pollution. Try to limit your exposure to indoor and outdoor air pollutants that can harm your lungs, like secondhand smoke, radon, and wildfire smoke. Staying hydrated. Keeping hydrated is helpful for your entire body, including your lungs, as being even mildly dehydrated can reduce lung function. Thanks for watching. To stay updated on the latest discoveries, make sure to subscribe to my channel and turn on notifications.